Mourners have a maximum of 2 hours to collect the body of a loved one and bury it to avoid congestion at graveyards and limit the spread of COVID-19. This change has often been traumatic for many families. Typically, it takes a week or more for mourners to be able to travel from different parts of the country or even abroad to come and pay their last respects. However, the coronavirus pandemic has changed things. The Walter Sisulu University Human Sciences Research Council and the Eastern Cape Premier's Office have partnered to look at the impact of these regulations on African practices and customs. We're joined by Dr. Nelly Sharpley from the Walter Sisulu University. Good evening, Dr. Sharpley. It's a pleasure to have you with us tonight. You know, when we talk about how people are grieving and mourning during this period, it almost becomes the exacerbated pain of having lost loved ones, because suddenly everything that you used to do as part of that ritual of saying goodbye seems that a lot of those things you can no longer do in the way that you used to do them. What are you finding in your research?
Thank you very much, Cathy, and good evening to the listeners at home. One of the important things was actually to look at the issue of COVID-19 pandemic as well as the government regulations, not just only in the areas where it's so obviously been actually covered, which is towns and cities, but actually to look on the issue of COVID-19 and government regulations within the rural setting in the countryside of our South Africa in the Eastern Cape. And what we're finding from the study was actually the fact that, one, local people needed to understand about COVID-19. Then secondly, from the regulations that have been presented is actually to say, how do local people realize the threat of the pandemic, and what is it that they're doing in order for themselves to survive the pandemic? And beyond that, also looking at the funerals, how is it that now during the time of lockdown, they are able to realize the rite of passage for those that have passed on from this life to another life, and how the families can realize such a dignified process during the time of lockdown. What I would say is what we found out in the study was the fact that local people are willing to communicate, but they really need government to come to them and be able to negotiate and understand certain things that need to be adhered to in terms of COVID-19 regulations. And also even to the very understanding of the very regulations. And also then when you look at that, you also look at the issue of the burials that people have to actually undertake. How do they understand the burials, and what is it that they have to do during the time of COVID-19? You realize the rules would say a limited number of people must be able to attend. And then you will find that local people, because they don't have much money to buy, they would actually do their own sanitizers. They will mix their own sanitizers. They will keep on burning what they call umhlonyane to make the point that people around the room are able to actually breathe in the substance of umhlonyane to protect themselves. Then, at the same time, with all that, you'll find that now, in terms of the rites of passage and also the mourning of the loved ones, there's one thing that the local people would always talk about, was actually the viewing of the body. So, do the lockdown regulations allow them to view the bodies of their loved one, to make sure that they are burying the right person, and also to be able to communicate to the one who has passed on, to release them in a dignified way by sending messages and talking to them in that way, in a cultural way, and follow those rituals. So one of the cries was the fact that they were not able to communicate to the loved ones, and then be able to understand whether the regulations of COVID-19 are actually regulations that can be able to negotiate that part with the people to be able to view the body of the loved one that has passed on, as well as being able to communicate the rites of passage and saying the goodbyes, because it gave them closure as well as giving a dignified funeral to the one who has passed on.
Of course, when we look at the Eastern Cape in particular, initially, the infection rate in that province was driven by the funerals that were being held and the fact that the numbers simply weren't complying with government regulations. Do you think that that would have happened differently if, in fact, there had been direct communication with the communities and, you know, taking them on board and helping them understand what's really happening?
Because the cry of the people, remember the regulations when they are communicated, even from national government, there's an emphasis on communicating to the relevant stakeholders on the ground. So for the communities, what are the relevant stakeholders on the ground that government can realize or has realized in the process of passing the regulations? So you would find that the issue of communication and them understanding where we are and what is it that we should be doing, the little they could get of that communication, they were able to adhere to such challenges. Look at the fact that they are able to produce their own sanitizers. So if they are able to count the number of the people that are coming in for the funeral and have their own registers to count those people, if they are able to actually close the gates, as they emphasize it, to say, you know, one of the things we had to do is actually to close the gate when there is still a family member who wants to come in, but the number is enough for the current people that are within that family that is mourning. So now we have to close the gate and somebody was supposed to be there. We're not used to that. We need people. During the time of a crisis in our families, we need to have people. But they were able, where at least there was an understanding, to adhere to the rules. So the most important thing was for the local people to know what is going on, understand what is COVID-19, and understand the rules that needed to be followed, and communicate those rules with the local people.
Would you say that there has been an additional trauma that communities are experiencing? You talk about the different processes that those you've spoken to would have wanted to, participate in as part of their way of saying goodbye to their loved ones, and the fact that they haven't been able to do that. What has that done to their own state and mental well-being? Did you ask that question?
Yes, definitely. That question came up. One, the indication that there is no closure. Remember, people don't just do things. There is a belief system behind everything that people have to do. So there is a belief system, sorry about that. There is a belief system behind everything that people have to do. And that belief system actually speaks to their wellness and well-being. So if, for example, you observe a certain belief system and your wellness is actually tied to that, in the process of saying goodbye to somebody who has passed on, you're also speaking to the wellness of your own life and well-being of your own life. So in a way of COVID-19 regulations, it did not allow that. It did not allow the communication even before there is actually a funeral. And then also the communication during the process of the funeral. You would find that local people would say, we so wish, for example, that there could be, a toll-free number that families would actually use to express themselves, so that somebody out there can realize the trauma that the families are going through during this time of COVID-19 and funerals.
COVID-19 is going to be with us for some time yet. Is there a way that, that there could be a relearning of some of these practices, that things can be done differently in order for people to still be able to say goodbye and have closure, but not necessarily risk themselves or even the community that they're in? Are those conversations happening?
Yes, definitely those conversations do happen. For example, in our study, we didn't only just talk to local people, and communities that are affected, because the study covered different stakeholders. It covered stakeholders from health, police, traditional leaders, traditional healers, as well as to the community people and the people who have actually had a burial during the time of COVID-19. And funeral parlors and burial societies, which are more in support or supportive of the families during the burial time. But we have also moved on to speak, to what I would call specialists and intellectuals in the line of understanding African culture. And what do we do with African culture when there is a crisis? And we talked, for example, I would mention some few people, although you do have also others from the religious community and so forth. But we talked with Professor Somadoda Fikeni, who has actually given us a clear picture of how were burials in the African way that actually enhances the African culture were being done before COVID-19. Now, come the pandemic, you need to save lives. How do you then start to negotiate culture? And it gave us a perspective of understanding that in a way of negotiating culture, you can't do that alone as government. You can't know and understand the culture of the people without being with the people themselves, and then be able to understand the processes, because he talked about the processes where tradition and culture and rituals have to be negotiated even during the time of burial, when you cannot follow the processes that you're supposed to follow. What is it that you do, and who does that? Yeah. So there is a process with the local people, and they understand they have to be saved in terms of they have to be safe in